Churn is a word we use in the software industry. I'm familiar with that. I have a dental software, and that refers to the people you're losing monthly. So you're churning through. So each month on a certain software, they're going to be losing a certain amount of people, and that's just normal. So in a dental office, we also churn. Like we also are losing patients out the back door, and we don't know it. We may not have no idea about that, right? So you can always look. It's like a dentist has been a dentist for 10 years. They have 3 hygienists, and for 10 years they've had 3 hygienists. But they're getting 30, 40, 50, 60 new patients a month, but they're never adding any hygiene. They're churning. You're losing some patients out the back door. What are some ideas or methods that we can use in marketing to either prevent churn or get those people back in the fold?
Okay, good. So first is a recognition, like what you just said, so many people can't, they don't think with that basic math. And when they do, they freak out a little bit, like, oh my gosh. And it's all up to that point. I just need more new patients. I need more new patients. But I say, listen, imagine this. You sell apples. So you get in your truck in the morning, you drive down to the orchard, you load the back of your truck with apples, and you drive to the market to sell the apples. But you don't have a tailgate. So by the time you get to the market, you got about, a third or a fourth of the apples you started with, but you still made enough to make the business model work. But it's tight, so you don't get a tailgate. You can't afford the $1,000 for the tailgate. And the next day you just do it again, and you do it again, and you do it again. This is literally what's happening. That problem you just identified is not generally understood by most dentists. So we call that retention and then reactivation. Our patients fall off the wagon all the time. That's a known thing. You're already starting from a back foot as a dentist because it's kind of a grudge purchase. Going to the dentist is not something it's not sexy. People don't enjoy it. It's not like, woohoo, get to go get, some people get enthusiastic about having clean teeth and sometimes a cosmetic case, right? But otherwise it's 100% I need to, not because I want to. So you're already battling with that. Then people are busy. We know that. So they don't necessarily do this when they should do this. So you've got to be on them. I see so many people so backed. Well, I send a newsletter every quarter. Is that too much? Okay. And how about routine communication? Well, we do send out 1, 2 every quarter, but it's a different time of the year. So I guess that's 2 a quarter. Is that too much? No. Think about this. Think about some purchase you made online. And, it's a store that you don't mind too much. And now all of a sudden you get an email every other day, every week, every other day, or maybe even every day, or maybe even a couple times a day. Does it happen to you?
Sure.
Do you unsubscribe from each one of these all the time? Yes or no?
Yes.
Okay. Most people don't.
Most people don't. I just hire somebody to do it for me.
Most people don't.
But you're right. Most people don't. My wife definitely does not. Yeah. She gets tons and tons of emails.
Yeah. And so you cannot overwhelm today's consumer with it. And if you do, they'll unsubscribe. And that's okay. That's okay. Better that you get people getting your message and electing out of it than never sending the message. So you cannot over communicate to your over commercialized public. And to understand that your message is so senior to anything else that they're getting, because healthy teeth and gums extend people's life by 7 to 10 years by independent studies, not done by you nor I. So this is important. And it's our goal, our job, our responsibility to remind them of this routinely, and then keep it not too serious, have some fun with it, but yeah, you cannot communicate too much to your patient base. So that's the first thing for retention. Second thing, have a very aggressive retention program in place and a protocol so that if your automatic reminder system isn't working and people aren't staying on it, then jump on that. Stepping back from that, are you making sure that before they leave that practice, they have their appointment? Who's doing that? And is that system in concrete, or is it a little bit soft? Is it a little bit like, well, listen, how does that sound tentatively? Good. Well, we hope that, we'll see you Tuesday and, 6 months from now. No, you got to be very definite about it. Having your hygienist who's got a captive audience there to educate that patient of the importance of that. And hey, listen, keeping these pearly whites pearly and white is way less expensive than letting time go by and getting, gum disease, which in some cases you can never cure. You can that education process is huge. And then when they do fall off the wagon, be aggressive about that. And that's that digital reactivation program you're doing, but also just a general reactivation approach. So again, people tell me, well, I don't want to bother somebody. I don't want to, so we get told we call people and text people too much. A lot of our patients say that. Guess what my next question is? Oh, really? Which ones?
How many?
How many exactly? Well, a lot of them. Yeah. Okay. Good. Let's write them down. Let's get your staff together. How many and who? Well, Mrs. Smith. Okay. Good. Anybody else? Well, Mr. Smith. Okay, her husband. Right. Good. Anybody else? Well, Joe Jenkins. Okay. Good. Anybody else? I think there was one other at least. Wasn't there a lot more? Oh yeah, David Jones. Yeah. Good. So that's 4 out of your 4,000. Oh yeah, good point. I see it. So you call these people quantitative pressure on anything. You get somebody reaches out. Yeah, you guys do cosmetic, right? Yeah, I'm looking at getting some veneers. Great. Yeah, all sounds good. Can we set that up and I'll get back to you next week? Okay, sure. You called that person every single day. And right after you call them and they don't answer because nobody answers their phone from a number they don't recognize, you leave a voicemail. And then when you're done doing that, you text them. And then when you're done doing that, you send an email if you got an email. It's a 4-step process, your outflow. 4-step process. And then you call them the next day. And then you call them the next day. And then you call them the next day. And you know how many times you do that? 12 to 16 times. And if they, by chance, pick up and say, my God's sake, would you stop calling me? I mean, and you just say, absolutely, I hate doing it too. I just want to get you appointed. So are we good for Thursday? Last time you came in was a Thursday. Yeah, let's end this pain. It's painful for me too. But people are so afraid of offending and scared to enforce when they shouldn't be. This is health. This is health. So get very, very proud of the fact and very, very noisy and make it medical. This is not the approach. Oh, hi. Yeah, we just want to follow up and make sure that you're still interested in coming and getting your teeth cleaned. This is not the approach. Hi, this is Becky. I'm calling. Dr. Owens asked me to reach out. So you missed your last appointment and it's kind of a concern. People with healthy teeth and gums live longer, but those people who don't have healthy teeth and gums are more susceptible to a whole number of systemic conditions. That includes heart disease, diabetes, stroke, cancer, Alzheimer's, dementia. So we're very, very concerned that you've missed your appointment. So how do we get you scheduled for either this week or next week? Is this week going to be better or next week? It's medical. It's not marketing. It's medical. So I'd say that's an orientation that, you've got a lot of experience with MGE, are helpful training to get your team to be very certain about their goal and their purpose and being impinging on that with their public. Not impolite, not weird, but just impinging. That's an internal office culture point. So,
yeah, I love that.
Yeah.
I don't want to mess up a quote here, but I'm sure you're familiar with about the stable datum of the size of the mailing list is directly proportional to the gross income of the organization.
Yeah. So the size, not the quality, and the number of mailing size of an organization's mailing list, and not the quality, and the number of mailings to it determines the gross income, which in our case is collections of an organization. So lots of communication to your mailing list, and your mailing list is your patient base. Lots of it, lots of communication, and the channels are just so numerous. Texting, emailing, direct mail, direct message through social media.
Now, I just want to give a shout out to this is not an advertisement, but we've been implementing the Bloomberg's reactivation and had just unbelievable response through texting. I mean, dozens of reappointments. I mean, I'm going to have to add another hygienist just through reactivation alone. And this has only been a month. We've only been doing it for a month.
Right.
So that's what had me interested in this whole churn rate is I don't have the exact, ROI on it yet, but it's going to be high.
Yeah.
It's going to be high.
Yeah.